Ladies and gentlemen, it's an immense pleasure to introduce our guest of honor, Dr. Palitha Mahipala. Now, few sentences have already been leaked out, but he was a medical graduate from Peradeniya in 1983 and then held many positions in the health ministry, medical officer to start with, district medical officer, then thereafter he has taken up the postgraduate career in public health as well as medical administration and many other different areas like business administration. So has then strengthened himself in a line of administration, and thereafter he has risen in the medical administration, being regional director of health services, and deputy directors, different deputy director roles in the health ministry, thereafter director general of health services, and ultimately the secretary to the Ministry of Health by the time we were developing as our faculty. Then he has not only been a national esteemed personality, but he has been an exemplary person in the world arena, where he has served about 2.5 years, I must be correct, sir, in the CRO, that is the Southeast Asian region of World Health Organization, and given the leadership to the entire region, not only our country. Thereafter, I learned that you were part of the WHO team looking at certain health needs of the Pakistan as a World Health Organization activity. So that is his excellent career that I want to mention, but I would like to mention a different aspect of his life and qualities, which will be an example. I took it as an example and will be an example to you. When we were having the challenges of developing professional units, I was traveling and meeting different eminent personalities, and being a dean of a new faculty, I could easily access you, sir, and you told me, if you want to meet me, you asked me to come before 7 a.m. 7 a.m. So that's the time you were available in the office, sir. So I took all these opportunities. I was really an opportunistic person. So I met you several times. 7 a.m., definitely before 8 a.m., so that you were there in the office. And a couple of times, the best times to meet him was 7, 8 p.m. So that is the caliber of the example that you place. You started early in the day, worked throughout the day, and you even were available at night. So being a high-level administrator, secretary of a ministry, that is the expectation to develop our country. Thank you very much, sir, for that example. I took a lot of things. And also, as a simple background dean, I could get your services very easily. You supported immensely. So that I must mention. And it is I would say, take those examples, and the future generations take those examples and be very good people who run extra miles, so that we may be able to take our country step by step forward. My invitation now to you, sir, to enlighten us on different areas possibly we are not very aware of. Sir, thank you very much for accepting our invitation also.
Thank you so much for the kind words of introduction. I don't deserve so much. The Honorable Vice Chancellor of the Wayamba University, Professor Ekanayaka, the Dean of the Faculty of Medicine, Dr. Sanjeev Bowatta, the distinguished members of the academia, eminent researchers, honored members of the medical fraternity, all our senior consultants who are present here today, the medical students of Wayamba Medical Faculty, colleagues and friends, ladies and gentlemen. I am deeply honored, truly humbled, absolutely privileged, profoundly respectful, and extremely pleased to stand before this august assembly of clinicians, scholars, researchers, whose lifelong dedication continues to illuminate the evolving landscape of medical science, to share some of my views, thoughts, and sentiments at this historical occasion, the first scientific medical research symposium. At the core, research is not merely accumulation of data, but a principled and methodical inquiry for truth, anchored in intellectual discipline, epistemological rigor, and ethical responsibility. Ladies and gentlemen, I am delighted to be here today. I am particularly delighted to speak today to this dedicated academic staff led by the Dean of the Faculty, eminent clinicians, and committed medical students of this young faculty, which already had one group of interns doing extremely well, and you are making the Wayamba proud for the nation. Ladies and gentlemen, let me at the outset appreciate, admire, and extend my sincere gratitude to the Dean of the Medical Faculty, Dr. Sanjeeva, for the invitation to witness this extraordinary and remarkable event today. Dr. Sanjeeva has illustrious tenure as the Dean, who has been served as an architrave of the academic community. He ensured that the researchers remain anchored in empirical truth and ethical rigor. His unwavering commitment and integrity paved the way for emulating professionalism among young academics. His extraordinary courage has profoundly shaped the development and progress of Wayamba Medical Faculty. His legacy will remain, I am sure, as an example for others to follow. I, as the former Secretary of Health, knowing his commitment and dedication, truly appreciate and admire him. I appreciate the excellent support extended by the Vice Chancellor, Professor Ekanayaka, who has taken step forward in many arenas and domains to ensure that Wayamba Medical Faculty, as well as the Wayamba University, is shining day by day. Colleagues and friends, ladies and gentlemen, science is fallible, theories change, knowledge expands, and can contradict earlier thinking. We have experienced it. All of this true, but none of it should stop science trying to tell us facts. To generate new facts, we need research. So therefore, let me focus on some areas where we need to move forward to find new facts and generate knowledge. If you look at the global research publication in year 2022, 5.14 million academic papers have been published in all areas, not only in medicine, health science, but engineering and other areas, in 46,000 journals. That shows that we have so much of opportunities available, 46,000 journals, and 3.2 million new books have been published in 1 year, year 2022. And journals, out of 46,000, 5,000 is from UK, and then USA, Netherlands, Germany, and so on. And there are 22 researchers, scientists, who publish an article daily. Every day they publish an article. And there are scientists from Sri Lanka who are among the top 2% of the global scientists. We can name them. I am sure in time to come, there will be some more from Wayamba University. And 10 articles published every minute. And if you look at by country, the publications, earlier it was USA and UK who used to publish more and more articles, but now China has took over. This is in 2021 data. Close to 1 million publications in international reputed journals by China or Chinese scientists. And you go on like that, USA, India is third by number, but quality is an issue, so it's ranked 6, then Germany, UK and Japan. And Pakistan from our region is the 30th, and Sri Lanka is 76th. So I'm so much grateful to the Dean of the Wayamba Medical Faculty to taking this initiative under the guidance of Professor Ekanayaka as a Vice Chancellor. So we need to move forward. We need to generate more evidence locally and beyond that. Again, if you go by, 60% of all the publication in the entire world are from 8 countries: China, USA, India, Germany, Japan, UK, Russia and Italy. We are nowhere there. So we need to generate more and more evidence. And even if you go by the population as a parameter, number of publication for 100,000 population, still we are very much lower down. And again, if you look at, because these information are important for the academic staff and researchers, where you should anchor, where you need to have the collaboration, which country, if you want to do research. And USA, EU and Japan more focus on health science, the medical side of it, molecular biology and so on. When it comes to China, 25% out of 4 research, 1 is on engineering. No wonder they fix new kind of modern bridges. You know how they develop the structures, infrastructure and so on. So they spend much more money and do more research work on engineering. And India is IT. So if you, depending on your interest and enthusiasm, you need to anchor to the different universities in different countries. And going further, over the last 10 years, if you look at what are the areas where more focus has been there by the global scientists, the top 3 fields: psychology. I think psychiatric issues, psychological issues are quite common, is more and more. So therefore you need to engage much more research work, how to address this issue. Then social sciences and then health science. So health is a very important domain where we need to do research work, and we have ample opportunity to move forward. Again, if you look at the amount of money spent now, China has taken over the number of articles published, then amount of money spent. Now USA is not there. Then main is China, 786 billion US dollars spent on research. And then of course few other countries, China, India, UK, Australia, Germany. So if you want to do research, where you should anchor, where you should find resources are from these countries. So these are, I feel, some of the important facts for you. And let me then talk about the health and going beyond that. And if you look at the life expectancy, number of years somebody going to spend at birth is the life expectancy at birth. And this is a composite index. It talks about the social side of it, the education, and also the health interventions. Health is only 60% health intervention. And we can say 50-50. 50% is from health side, 50% from other side. Say the local authority put up a walking track is a health intervention. You reduce overweight, you reduce heart attacks. So health is a subject where there can be more intervention from other side. So if you look at the life expectancy, which is a composite index, talks about the health system and healthcare delivery in a country, and you can find the Monaco has the highest. Monaco is the second biggest country in the world. The smallest country is Vatican in Italy, which is 1 square kilometer. This is just more than that. It's a very small country. 89 years, 89.2 years is the life expectancy. Where Sri Lanka is 77. So 12 years more. And if you look at male, female, I will come to that, is even much more. And world average is 73. Sri Lanka is 77. We are not that good. And if you look at UN data, 2020 we were in the 54th position as a rank. We have come down to 63rd position in 2023 and 74th position in 24th. That means we are developing, we are progressing, but not enough. And other countries are moving faster than us. So that's why if you look at Maldives, their life expectancy is 81. And in 1960, Maldives' life expectancy was 31 years. They have gone up to 81 now, passing us. And there are many other countries from our region now gaining health much more than us. So we need to think about, is our system delivering what we expect? It was delivering very well. The model we had was more focused on communicable diseases. We have done extremely well in the past, but now our context is different. We have more non-communicable diseases. The past model we use is not working anymore. So we need to change it. We need to transform it. We need to reform it. And if you look at the Global Knowledge Index, I have highlighted this many times. I had an opportunity when I was Secretary of Health where we were meeting together with Education Secretary, the Honorable Prime Minister and all that. So I was quoting this many times. Look at where are we? We are in the 93rd position and there are 8 parameters to look at. Do we have any university which has a rank below 1,000 in Sri Lanka? No. So they look at the primary education, secondary education, tertiary education, amount of money spent on education, allocation on GDP on, and all that. And then of course various other things and develop this composite. So one of the issue is we don't spend enough on education. We have great academics, we have wonderful vice chancellors, we have very committed deans, but you need to have more money, you need to have more staff, you need to have fund for research. How much of money we spend on research? Many countries go beyond 1.5% of the GDP on research. Sri Lanka even not 0.01%. So therefore we need to think about this and see the Myanmar, Thailand, Indonesia, all are above us when it comes to the Global Knowledge Index. And then the next one, which is linked to the both of them, the average IQ by countries. Now there's a way of calculation, the average IQ. We have high IQ people, no wonder. We have academics, we have learned people, we have medical profession. But then, if you look at the average, see Singapore, Hong Kong, the other countries, China, Japan, Korea, South Korea, they are doing extremely well, highest level. So where is Sri Lanka? 124th position. And what is it? 78.6%. So this is our average IQ. So we need to really transform the education system and we need to make people more understand logical reasoning, analytical of information available and improve our IQ. So we need to have enough reasons for going for the education reform. So health side, we have started by appointing a think tank. When I was asked to come and help Sri Lanka, I was doing my job in World Health Organization. I got another appointment. But then of course I was requested whether I can come and help. So when I was coming back, I was thinking on the plane what we should do. And I jot down 25 names. Immediately the day I assumed duties, I appointed a think tank. 25 eminent professors from the medical faculty, not from medical side, outside the medical side, IT professionals, and they used to meet every other week. And we discussed, I used to go and present the data to them. And after 6 months, we formulated the health sector reform agenda. And then of course started going province by province, meeting the political leadership, high officials. We have come to Wayamba as well. Presented our intention, vision for next 20 years. We need to think about next 20, 25 years. If not, we have a fast glory. We have done well. We have eliminated malaria. We have eliminated polio as a first country in the region. And our life expectancy was high. But now We are not moving enough. Our health gains are not enough. So therefore, we have a past glory, but that will not reflect in another 10 years' time unless we change on our investment, have more piece of work on research work to find data. So, and universal health coverage is an index, that talk about access to health care or delivery of health care, equity of health care delivery. We are 67, Thailand 85. That means we are not doing well. So we need to reform the primary health care, secondary health care, tertiary health care. We need to reform it as an agenda. And for which, of course, we have done our work, and I am sure now it's moving forward. And look at the countries doing extremely well in life expectancy are the countries having wonderful health systems as well. And one of the issues we have throughout, now Monaco difference between male and female life expectancy is 7.7 years. That means female live much longer than men. Men die early. And there will be so much of widows time to come. That's a huge issue. The mental issue, psychological issue, rehabilitation issue. So it's throughout except Switzerland where it is minimum. Because men, smoke more. 33% of the people smoke. When it comes to female, it's less than 5% or even less. And then, of course, unhealthy diet, no physical activity. So men die early. And female have another positive hormone, estrogen, that protect them from many risk factors. So therefore, male die early. So we need to see how best we can prevent this. And now, more and more deaths among the male population during young age, we call premature deaths, are very high. So, looking at all that, if you look at the priorities, I don't know how far I can go time-wise. I'll try to, cut short it. We have NCD as one of the biggest issue. 89% of deaths in Sri Lanka are due to NCDs now. 89%. All the other deaths, 11% due to other diseases. So it's heart disease, cerebrovascular accident, cancers, diabetes, and lung diseases. That's all. All NCD, very easily preventable. 4 risk factors, we call 4x4. What are the risk factors? Smoking, unhealthy diet, alcohol consumption, and physical inactivity. And globally, if you look at the trend, globally 55 million people die annually, out of which 42 million die due to NCDs. 70% of people die due to NCDs. But in Sri Lanka, it is 89%. So our NCD prevalence is quite high. And then the majority of the risk factor globally is smoking. Smoking causes or kills 10 million people. Cancer, another 10 million. That's how it goes. And cardiovascular disease, 17.9 million people die globally due to heart disease and cerebrovascular accidents. But Sri Lanka, if you look at the risk factors, say non-consuming fruits and vegetables is the majority of risk factor. The unhealthy diet. Unhealthy diet. So you need to work on this. If you spend $1 on diet, your return is $14. Your return is $14. If you spend $1 on treatment for cancer, your return is $1.67. So where are you going to spend your money? The prevention. Very simple. Stop smoking. So WHO has recommended what is called best buys. What should be done? You have to increase tobacco taxation. Tobacco cannot be sold to young people. Common places you can't smoke. Like that, there are many things recommended. Diet also same. Low salt diet, low fat diet. So those things we are not addressing much. And alcohol, every kilometer you find a bar. You don't find a hospital or a school every kilometer. But you will find a bar which sell alcohol. And it's going up. Density of bars, numbers are going up. So how we are going to reduce this? And we have done a study. I remember when I was the Director General Health Services, we every year, Honorable Vice Chancellor is aware about this. The Treasury Secretary calls a meeting with each ministry and asks what are your priorities, how much of money you... So I was the acting secretary that time, this is 2015. Dr. P.B. Jayasundara, who is from Wayamba province, was the Secretary of Finance. And I asked more money. He said, for what? I said, for drugs and medical testing, because NCDs are on the increase. So we had a huge argument, and he said, I can't give more money. And then, of course, I said, we need to increase tobacco taxation. If you don't give money to us, that's fine. Increase tobacco taxation. Get more money to you, and then give part of it to us. It's a win-win situation. He said, no, if you increase tax, I don't get 100 billion. They get 100 billion those days. This 2015, 100 billion from tobacco, 46 billion from alcohol. That was the taxation. 146 billion they got. And we have done a study with a team from Thailand and WHO. The expenditure on tobacco, alcohol related disease and the social cost was 246 billion. So you get 146 billion as your income, you spend back. So where's the argument? I said you have to listen to us. But unfortunately, the system is that, people don't listen. They don't go by the scientific facts. And other countries, they do. Thailand, they went for tax increase. Philippines, they have gone for. Nepal, even gone for. When I was in Sierra, I have gone to 8 countries and increased tobacco taxation somehow after meeting parliamentarians. So we need to really do much more work. Your expenditure is less, but your results are much more. So therefore, look at the diet. And the other thing is physical inactivity. 22% of people get NCDs because of physical inactivity. Simple thing. Because now you don't find farmers. Those days it's different. So therefore, I'm just highlighting NCD area is one for all of you all to do research work. Simple operational research. What we should do. What we should do at the village level. At the Gram Sevan Ildari level, what kind of interventions? Wayamba University can take over the Wayamba province and start implementation it. Those are the simple things we can do, make the country progress. CKDU, chronic kidney disease of unknown etiology, and Wayamba, Polpithigama, Nicaragua, those areas were affected, mainly the North Central province, and now it's coming down because we have done, I was chairing the research consortium for 4 years when I was the additional secretary health, and we were able to come out with some postulation. We got 100 million rupees from WHO to do it. We spent that, did the analysis, and one of the intervention was giving water supply, and we started to see it's coming down. But there's so many of his stories I can link, because our findings were not accepted at the beginning. When we said, some people have gone to the goddess Natha and said, Natha Deyo said this is arsenic. We spent 100 billion, the global best researchers, we got down to Sri Lanka, the global best. And we started formulating our hypothesis and go on. And we have our findings. We could not table it. We could not publish it. The first article was published after 4 years in the international journal, not in Sri Lankan journal. Because it was not accepted. People say, no, this is simply this. So therefore, research is one, then research publication is another one, then get the people to accept it is another one, but still the CKDU is a big problem and you need to really look at. Nutrition, we have not made any progress. Low birth weight, she will tell, 14% for last 20 years. No interventions done, no improvement. Stunting, 1 out of 5. 20% is stunted, our population. That's why we see height is low. And then wasting. And then, which lead to high fat and other things which lead to NCDs. So nutrition is another parapan area where you need to work hard. Then the elderly population. Sri Lanka is the fastest aging population in the entire South Asia. And second fastest aging in the entire world after Japan. So 13.3% above 65 now. And by 2041 it will come to 25%. 1 out of 4 will be above 60. Where the rehabilitation, how to look after these elders. So we need to really look at what we are going to do. Are we going to have elders home? Are we going to integrate it? How we are going to look after the primary health care? That was one of the reasons for primary health care reform, to deliver integrated care, elderly care, palliative care, cancer care, rehabilitation as a package at the primary health care level, village level. So we need to really think about, these are areas where you can do. So NCD, if you spend just $1 for the education, you get $7 return. If you spend $1 on healthy diet, you get $14 return. If you spend $1 on smoking, anti-smoking campaign, you get $11 return. So these are the areas we need to work hard. And the amount, see the amount of money, next 20 years, 47 trillion we are going to lose globally. 47 trillion. You can make this world a beautiful world if you stop smoking and those things. So we need to really focus on NCD. And coming from Sri Lanka context, we had a wonderful philosophy some times back. We call our wellness philosophy. We were not focusing on diseases. This focused disease, the biomedical system is from 1505, after we invaded by Portuguese and Dutch and then put up hospitals and so on. The Western medicine is wonderful, that's great. But we don't look at holistically. And now, I remember when I started my internship, we had 8 specialists, 4 basics: pediatrics, gynecops, medicine, and gynecology, and surgery. Now, then of course we have anesthesia, dermatology, eye and ENT. Now I think 56. And each organ you have somebody. And even joints you have different people look after, So it's good, it's great. They are doing a wonderful job. But now no one to look at holistically. And I have seen I have a small house in Mathura, I had a watcher. Recently when I went, I asked, he was not there. He has gone to the clinic. And he's going to 3 clinics. He has heart, back ailment, and so he has been prescribed 13 drugs. And he is eternally having gastritis. And I look at it because he goes to, somebody, rheumatologist, and tell, I have a back pain. So he don't tell anything other than that. He is having hypertension, he is treated for that. And then he has, had ischemia. So there's nobody who look at holistically. We focus on systems now. Liver, heart, and you go by that. Now America and many other countries now started what is called a specialty called holistic medicine. Focus on holistically look at somebody. Earlier we had GPs. They go to the different specialists. Specialization is wonderful because then somebody only focus on some area, they become really expert on that. But then you had somebody has to look at holistically. So these are the things we need to look at. And then of course spiritual health. Health is looking at as a well-being, the happiness, the positive side. Now Bhutan is a country, one of the smallest country in the world with 500,000 population. They have an indicator to look at health called GNP, GNH, Gross National Happiness. They measure happiness. So wellness is wonderful philosophy. Earlier people do cultivation, then evening they go to temple, they engage in meditation and spiritual health, no much issues. You can't go back to that now, but your research work has to be done how we can use these facts and develop, because these are in our DNA. And I just thought 2 institutes to be highlighted. I think you are very much known about Robert Koch, who found TB bacilli, who found Vibrio cholera from Egypt. So the government has set up an institution called Robert Koch Institute. It came as a research institute. He was the founder, director, and then named it. So he was awarded the Nobel Prize also. And they have done a lot of research work in Germany. And on the other side, the France started the Louis Pasteur. Louis Pasteur is a known person, microbiologist, immunologist, chemist, and bacteriologist. He postulated germ theory, and he invented the second vaccine. What was the first vaccine? That was smallpox. by Edward Jenner in 1796. 90 years later, Louis Pasteur found the second vaccine for rabies. So these two institutes from two countries, bordering countries, developed and did so much of research. And I highlighted these two institutions, they were not rivals, but they were competing to find out. And at the moment, we have so much of collaboration. I'm telling these things because it's important for you. On zoonosis, we are working with Robert Koch Institute. And they are very much focused on zoonotic diseases in Sri Lanka. And they will grant you money. They have already established a laboratory in Colombo University. I think Wayamba, you have leptospirosis and so on. You can start collaboration. We need to identify such institutions for funding. And Pasteur Institute is a similar one in France. And so we have, same time, this all started in late 1900s, that's 1880, like. In 1900, we have started one research institute as a individual donated philanthropic work by Charles de Souza, who has donated the DMH, same person. And that is MRI, Medical Research Institute. In 1900, long years back, same time when other institutions were established. What are they doing now? It looks a glorified laboratory today. No research work, though it is MRI. And people used to call Medical Resting Institute or something like that. They do some work, but we need to do much more work. And 1903, we has a global renowned pathologist there as the head of the institution. Aldo Castellani was a renowned pathologist globally. And for his name, the auditorium is named. And then, of course, we had people like globally renowned, recently passed away, Professor Tissa Vitarana. He is another virologist. And for dengue, he was global authority like. So we had such people. So we need to now start linking with MRI, linking with such institution in the regional countries, and then moving forward. I don't want to go into such details now. And finally, when you passed out, as medical students are there, you want to be a clinician or you want to be a researcher. I recommend you to be both. If you become a clinician, you look lucrative. You can accumulate wealth. You become a wealthiest person. If you become a researcher, no wealth, but you will accumulate wisdom and knowledge. So finally, at the end of the life, you both die. Nobody takes anything back. But if you accumulate knowledge, you add an attribute to the global body of knowledge. And your legacy will be there. Your legacy will be there. As a clinician, you can do a lot of work to the people. So if you do the clinical work as well as research work, you become a wonderful personality. So my recommendation is don't put research side down, take it forward. While you're becoming a clinician, do that as well. And research, we compile data, we collect data, and then we analyze data. What is intelligence? Intelligence, again, is ability of the human mind to gather an appropriate use of information, something much intertwined. So, and generally we say, if the average IQ, the highest we had, Singapore, 106, anybody has 100 is okay and can go to university. And they say usually it's from 85 to 110. And Peradeniya, during our time, there was IQ test done for each and every batch, for all the faculties. They found that engineering faculty, something around 125, 130, like medical faculty, 120. I remember we had our IQ test, and many of the people didn't come. Few of us, we went. We got our IQ, not bad, but many didn't come. So it's good to start, looking at this and see how best we can improve. And there are people whose score is 400. This man, 13 years, he's American, completed his degree. But then the father put pressure so much to complete his PhD within few months, and all that. He vacated everything, disappeared, and now he is having his own life. But there are people who are having more than 200 IQ. And Michelangelo is one. Leonardo da Vinci is one. Who's known, they have never gone through IQ tests, but now there are methods to estimate it. So IQ is very important, and that's linked with the research work as well. So intelligence, there are definition, mental capacity, alertness, logical reasoning kind of a thing. And for military, it is strategic information. But finally, research and both, you collect information, analyze it, come to facts, and then, of course, share it. So intelligence, you know IQ, then you have EQ, emotional intelligence. What is most important is that has different dimensions or domains. Say, the mathematics, logical reasoning is one, music is another one. Now they found, most of the musicians, the brain, they have found a notch. They found the same notch in Einstein also. Einstein was known to be a good musician as well. So, see, interpersonal. Sometimes you find guys, leading us, giving decisions to us. No IQ usually, they can't do mathematics and all that. But their IQ, say, interpersonal IQ, they are superb. They can formulate stories. And the way it is told, people believe it. So that's part of IQ. You see, so IQ is in different dimensions. Some really can speak languages. They are not educated much. But 2-3 months they spend with their neighborhood, they learn a language. Say guides, where they have gone, no certificates, but they speak beautiful English. Conversation. So artificially, I talk about it because now it's a time for artificial intelligence. Now, medical profession is started to use it globally. It's high time for us to think about it. Radiology is one area where it's used mostly. Cancer treatment, outcomes, logical analysis, cost effectiveness in public health and epidemiology, we can use it now. There are models available. And radiology, Singapore, they use it. Now all these MRI, CT scans, it goes to, whatever the findings, goes to software, and they prepare the report and make differential diagnosis. Still it's not considered until the consultant signs. So it suggests to the consultant, this can be this. It's very easy for them. So we need to really think about our future. So having said that, I thought I will quote few personalities and stop my speech because maybe too long now we are dragging. Einstein. When you talk about intelligence and IQ, you talk about Einstein. Einstein's brain has been stolen. When he died, after post-mortem, suddenly people found that his brain is not there. And they found it in late 80s. He died in 1955. So then later it was cut to pieces and given to many universities to study. Now in the brain, we have two cells, very easy. Brain functions are very simple. Neurons we have, glial cells we have to supply the nutrition. We have 86 billion neurons, we have 86 billion glial cells. But we have synaptical junctions, 100 trillion. 100 trillion. So that's why people say, people don't use the brain. We have so much of cells, how to use it? 100 trillion synaptics. You don't use it. So Einstein, the people thought, how I will talk about what he has done. He's a great scientist. Still people don't understand what he has said. So his brain, parietal lobes are wider, 15% wider than other general average. And he has no Sylvian fissure. I think you all have done anatomy, so you remember anatomy we have done 30, 40 years back. Sylvian fissure is not there. That means you have more connectivity. Corpus callosum is more thick in Einstein brain. That shows that more connection. And his number of microglial cells have been much more than others. So brain has been looked after very well, nutrition side. So it's quite interesting. He won Nobel Prize. He was just completed his degree from a technical college and he couldn't find even a job. He was not taken to a university for, I'm sure now of course such people you somehow select, no? Honorable Vice Chancellor and the Dean will pick such people. So he was not given. But later, he born in 1879, When he was 25 years, he wrote 4 papers. And those papers were published, and people start to say, oh, this is wonderful work. He wrote one paper on photoelectric effect, and 96 pages, for which he has been given a PhD. So one of the shortest PhD theses in the world, wrote by Einstein. So very interesting. And later he became such a wonderful person. Isaac Newton is another such person. He has done so much of work, mathematics, and then of a spectrum of colors, all that. He's known as one of the best and foremost scientific intellects in all times for last millennium. Bertrand Russell is another person. And this man, the man who knew infinity. Anybody knows about Ramanujan Srinivas from Tamil Nadu? There's a film, The Man Who Knows the Infinity. There's a book, and based on that film, it's good to look at. He lived only 33 years. He could not proceed in his school because he can do only maths. He can't do anything else. So he was chased out from the school because he can do only maths. He don't score other subjects. But he started, doing accounting in small restaurants and all that. Those people found that he has a super brain. Then they wrote behalf of him to Cambridge University. One professor called Professor Hardy invited him there, and he went and he has done wonderful work. He was included in the Fellow of Royal Society. That was the highest honor somebody can get, the second Indian to include. He was talking about complex analysis, number theory, infinite series. And once Einstein said, infinite, I don't know whether there's an end, but I am sure it's stupidity. There's no end. So he must knowing all these things. So he's self-taught person. I said this because we had a similar person in Sri Lanka, known as Arlis. I don't know anybody senior. It was reported by one of the community physician, Arya Sena Yugamage. And I have met him. When I was third year in Peradeniya, one day Professor Carlo Fonseca came with a 30 years old man, introduced him as a trained maths teacher. And Professor Carlo brought a specimen of a brain, and so this brain is so powerful, listen to him. So he put a small, in the science faculty lecture hall, maybe more than 1,000 people were there, all the students, and all professors, maths, engineering, all were there. And he put a small formula, something only he understand on the board, very small one. And then he said, ask any question. So I remember the maths professor got up. He wrote a huge formula from one end to the other end. And then he wrote the answer to that. So all were very upset what's happening. Then, of course, people start to ask many questions, say all squares and all that, 49 into 49 into 49 like tens. He tells. So he is that kind of a man, but finally he didn't want to tell what is his formula, and he just lost. We lost another Ramanujan in Sri Lanka. So this research work, we need to find people who has extraordinary brain as well. So finally, ladies and gentlemen, research is a very interesting subject, and we need to know beyond medicine. And when you are a medical student, you focus on medicine because you have to get through your exams. I'm sure Dean and the academic staff will ask some other questions as well and give some additional marks. It's not only for medical questions. And that is very important. We need to have more researchers. We need to create an interest among researchers. We need to do more research work. We need to publish it. And we need to have forums. So I'm delighted that the Wayamba, under the guidance of the Honorable Vice Chancellor and the leadership of Dean, has started this. I'm delighted to be here. And let me finish with the quotation from Louis Pasteur. He said, science knows no country because knowledge belongs to humanity and is the torch which illuminates the world. Science is the torch, research is the torch which illuminates the world. Einstein said we cannot solve the problems with the same thinking we used to create. We create problems. We can't solve with the same thinking. So we need to do research, have a different thinking. And finally, if we knew what we were doing it would not be called research. So we have to do not what we are doing usually, we have to do something new. I stop here. Thank you so much.
Thank you, dear sir, for that inspiring and enlightening speech. And I kindly invite you to remain on the stage. As a token of our sincere appreciation, may I respectfully invite the Vice Chancellor of Wayamba University of Sri Lanka, Professor E.M.P. Ekanayaka, to present a token of appreciation to our esteemed keynote speaker, Dr. Palitha Mahipala. So may I kindly request you to come forward and accept the token of appreciation. Thank you, sir. Thank you again, sir, for honoring us with your presence today. I kindly invite you to take your seat in the audience. Ladies and gentlemen, the moment we have all been waiting for has arrived, the award ceremony of MedRES 2026, the highlights of today's program. It is now time to honor excellence by presenting certificates to our best oral and poster presentations and appreciate their research. Not only research excellence, we have a very special award for MedRES 2026, an award that celebrates innovation, creativity, and excellence, and will be remembered as part of our very first edition.